This is Market Pathways, your premium guide to global medical device regulation, reimbursement, and policy. Become a part of the global MedTech community at mystrategist.com.
Ryan, thanks for doing this. I'm Wendy Diller. I'm a senior writer with MedTech's Strategist, and I'm talking here with Ryan Zimmerman, a managing director and senior equity analyst at BTIG, a senior equity analyst MedTech at BTIG. And we're talking in the midst of a very consequential news volume, as well as upcoming medical meetings, notably the AAOS, which starts next week, SAGE also, which I think Ryan will be attending. And I wanted to get your perspective, Ryan, on both on the general landscape and also specifically on what to expect at AAOS, for our readers. So basically, you've been, doing it. You just came on. BTIG just had its. Is it Snowbird Summit? Is that the summit? Yeah. BTIG just had a Snowbird Summit where dozens of med tech companies presented and got together. You've been attending meetings and you are been writing ferociously about the sector. So given the outlook, and what is your outlook for med tech in 2025, especially given the unpredictability of what's going on in DC?
Sure. Well, first, Wendy and MedTech Strategist, thank you for having me today, and appreciate the opportunity to speak on the sector. As far as the outlook goes, obviously been a bit volatile, particularly with some of the various policy changes that have come out of DC. But the sector is coming off of, I think, fundamentally a really good quarter where we've seen patient volumes that have been fairly healthy, particularly in the U.S., in a number of areas, not just orthopedics. A lot of patients opting for surgery at the tail end of 2024. Unemployment rates were low. People were feeling good about the economy for the most part. And I think that has helped the sector kind of close out 2024. As we move into 2025, go ahead, Wendy.
Oh, so were those elective? Is it the elective procedures that make the difference then? You're talking about there's a consumer sentiment driver built into that. And is this, do you think, part of a post-COVID surge, continuing the post-COVID surge, or we're beyond post-COVID? Or does it matter?
Yeah, no, I think we're well beyond that. If you talk to most company executives, this is not a backlog dynamic necessarily, or a quote unquote catch up post-COVID. I think we've worked through most of that a while back, and this is really just the demographics, if you will, call it the baby boomers, et cetera, opting for surgical intervention, elective orthopedic procedures, which we're going to talk a lot about, and the volumes have generally been healthy, and they're supported not just by the demographics, they're supported by the technological innovation that has fostered better outcomes and increasing patient demand. So, for example, and we'll talk about robotics in orthopedics, for example, but we think that has been a major trend, as well as the shift to outpatient care, knee and hip or knee surgery in the ambulatory surgery center, which has grown tremendously over the past few years. But just to go back to DC a little bit, you kind of asked about what's going on in DC and our thoughts on that. Most of the focus, for better or for worse, has been outside of MedTech. Most of the focus has been on things like pharmaceuticals and nutrition and more so the providers. And MedTech has been somewhat insulated from some of the fluctuations and the policy rhetoric that's coming out of DC right now, which has made it somewhat of a safe haven as a sector for investors. If Medicaid were to be cut, which is obviously that's on the table right now, there's a lot of discussion about that. I think there would, not just I think that there will be an implication for providers, but more so as a derivative into a procedure demand, and we need to think about that. And we are thinking about that in the context of from some of the med tech companies. We think about the capital equipment environment, which has generally been very healthy. Companies such as GE Healthcare we cover are seeing tremendous, robust demand in the U.S. right now for imaging equipment. But we worry about hospital CFOs feeling more pressure if, say, Medicaid were to be cut. Now, again, as of this weekend and as of last week, we saw Republicans, tell people that that is not on the table, but it's certainly been in discussion and something we're kind of watching closely. Let me pause there.
Yes, that's great. What other, you mentioned orthopedics, and a lot of our discussion is going to revolve around orthopedics, but also what other areas are seeing what other surgical areas and med tech areas are seeing strong volume and healthy growth, healthy sales?
Yeah, I mean, we're seeing it, ortho. I don't know if spine necessarily applies directly to ortho, if it's kind of on the margin of, saying ortho, but we're seeing very robust demand in the spine market. We're seeing, great numbers out of companies such as Medtronic, out of Globus, even with other larger companies such as Stryker getting out of the spine market and divesting that to a private entity. We're seeing really healthy demand in spine. And if you look beyond that, I think if you think about some of the numbers we've seen in areas that are maybe less elective, neurovascular, for example, or even peripheral vascular, where we think about, treatments like single session therapy for deep vein thrombosis or pulmonary embolism or coronary clots. The volumes have been pretty robust. And we're talking about, markets that are in sub 10% penetration, but growing steadily in the 20 to 25% range sustainably. So, pretty healthy growth.
When you said 10% penetration, you talk about the penetration of those. There's plenty of room for growth.
Yes,
okay.
That's what I'm suggesting, that there's tremendous runway here for growth away from drug therapies.
Yeah. And I know you're not drinking the Kool-Aid because I've heard you be negative. You and I have talked in the past, and you certainly have been negative on med tech and in particular the orthopedic sector. It's really a change over the years to hear you and others describe the sector as healthy.
Yeah.
What are is demographics? You mentioned innovation. Are there key?
Sure.
You mentioned robotics. What other innovations are driving?
Well, I think it's a couple things. So we talked about demographics. We talked about technology.
Yes.
I think we came out of a period of high inflation, and not to say that inflation, we've conquered it or anything like that, but we came out of a very high inflationary period post-COVID. Providers were willing to accept price increases from industry at higher levels. We've seen certainly less price pressure in the past year than we've seen historically, or what we normally think about as price pressure in the industry.
Yeah, why is that?
Yeah. Well,
that was
again,
a surprise. That was a surprise in the earnings calls when I was listening to the earnings
Sure.
calls, and pricing pressure is not as much of a factor as it has been. Yeah.
Well, I think, raw input costs were up for a period of time post-COVID. Fuel and energy costs were higher, and manufacturers were feeling the effects. And it's not as if, third-party payers adjust reimbursement just because oil prices are high the next day. And so when that happens, I mean, a lot of those manufacturers had to go to hospital providers and, argue and lobby for price increases on their products. Now, once that, those pressures died off, we didn't necessarily see prices fall down. We saw prices remain steady, and that benefit, or maybe a lack of a headwind as we're used to seeing, carried through much of 24. That doesn't mean we expect that to continue. We expect pricing dynamics to normalize. And if you talk to some of the bigger companies, they're calling for maybe pricing to be, maybe about a 50 basis point to a headwind to a 50 basis point tailwind, essentially flattish. We've heard some people suggest about a 50 to 100 basis point headwind. That's still better than 100 to 200 basis point headwind that we're used to seeing. But we do expect, those headwinds, to moderate over the course of 2025. And really what we think about and what we think is much more consequential is volume. So, volume in orthopedics, volume in spine, tends to grow within, a mid-single digit range. We expect that to hold steady. And again, if you don't have those headwinds hitting you, that helps with better growth as an industry. And again, we expect those headwinds to come back a little bit.
Do you expect the threat of tariffs? I'm changing the topic, but do you expect the threat of tariffs to affect the sector?
Well, yes, it's a day by day process, right? So
yes, very much.
We've watched the discussion out of DC on tariffs, and we look at it closely. So, for example, I'll just give you an example. We look at the fact, and I'm going to step outside of orthopedics for a second, but 90% of the instrument and accessory revenue that's produced for Intuitive Surgical was produced in Mexicali, Mexico. So, Intuitive has a decision to make. Do they bring some of that manufacturing back to the U.S.? Do they absorb the cost of the tariffs? And by our calculations, we think that's about a 50 cent EPS headwind in 2025 for Intuitive if those tariffs were to hold and to go into effect. We did that work, I think, in February over the course of the weekend. And then on Monday, those tariffs were walked back and there was a reprieve for a month. So, we're sitting here March 3rd, the tariffs are expected to go into place tomorrow based on what we've seen this morning. And so companies will have to absorb those tariffs. Last time we saw tariffs in the first Trump administration, there was a carve out for medical devices, and most MedTech got a reprieve from that. As of right now, we haven't seen that, but we're watching it closely, and we think, it's going to be somewhat of a headwind for companies that are exposed both in Canada, Mexico, and China. The good thing is, let me just say this, a lot of companies that produce in China that, China is right now subject to a tariff, produce products and services for China as opposed to, say, shipping it back to the U.S. and facing those tariffs. So we think, it's manageable. I don't think anyone wants to see these tariffs, but the fact of the matter is the companies have been able to manage it thus far.
Yeah, and they can, and it also depends on how much pricing flexibility they have.
Right.
It depends. Okay. Okay. And so how are you working that in your estimates for various companies, or how are you building that into your modeling?
Yeah. Well,
that's a tough one.
From a purely analytic perspective, what we try and look at, and some companies disclose it more specifically than others, but we tend to look at the manufacturing exposure by country, and we make assessments and hypotheticals around the revenue exposure that each company may have, and then in turn apply, a tariff estimate to their manufacturing costs, and then run that through our models, and then that usually spits out some type of EPS headwind relative to our current expectations, and then we adjust for that, and we think the market adjusts for that too. But as I said, it's a day by day process, and sometimes the headlines are positive, sometimes they're negative, and the market has been kind of gyrating based on those dynamics.
In orthopedics and spine, which companies are most exposed, which are most vulnerable to?
Actually, the good thing is there's been a lot of talk around tariffs, I think around copper and aluminum and steel. There has not been talk of titanium. Most implants that are used today are titanium. So, the good thing is that the tariff exposure has been fairly de minimis, I think, for most companies we speak with in the orthopedics industry right now. There are components that come, subcomponents that come from other markets that may be assembled in the U.S., and there is likely to be some added cost for those. But for the most part, we don't think, from what we know, that there's been a big tariff hit the big orthopedic manufacturers as of right now.
Good. Okay. Um, what would you say, what are some, moving to orthopedics? Well, one other question to ask you is, what would you say is what is the appetite for healthcare systems to adopt technological current innovation, at the moment? You've been talking to supply chain executives, and, any takeaways from that?
Yeah. So on capital equipment demand right now, actually it's been very healthy. We've come off of a really strong year of capital equipment demand at most healthcare systems. And the reason being is the finances of those systems had improved over the course of 2024. Patient volumes were healthy. The market did well, and a lot of not-for-profit health systems, their endowments are doing well. Those investments are doing well. That trickles down to capital spend for a lot of health systems. So when the market does well, we tend to see stronger capital equipment cycles. As of right now, capital equipment in the U.S. has been fairly healthy. And we see that. We see that in the results of companies like GE Healthcare in the U.S. We see it in the results of companies that are tied to equipment such as Globus in terms of their robotic systems. We see it in Stryker's pipeline and the capital demand for their products. So right now, we feel pretty good about the U.S. China is a separate story, and I think many people who watch this know that the macro environment in China has been challenging, and that has challenged some companies in that market a bit more than the U.S. But generally speaking, we feel okay about capital equipment. We're watching it closely, though. We think one of the things we worry about is, if rates don't go lower, if interest rates continue to go higher, if Medicaid is cut, we worry about the health of some of the health systems and their operating margins, and we worry that capital could get a little tighter over the course of 2025. And it's obviously a fairly dynamic situation, but as of the last earnings cycle, which is just a few weeks old, most companies are feeling okay.
Does the unpredictability, are healthcare systems going to put a pause on spending, do you think, because of the unpredictability, because they don't know what is going to happen with some of the factors you're talking about?
Yeah, it's an interesting question. I mean, I think there's always certain things that need to be replenished, right? Need to be repaired. And so what we see is maybe more specificity about what is bought. We certainly see more leasing activity, and that's evident in some of the placements of robotic systems, the high dollar items, the intuitive, robots. That's not a new phenomenon, but certainly there's been more activity, more of a shift to operating models away from outright capital purchases. And we think that continues regardless. If things change, again, if Medicaid is cut, we do think that a hospital CFO is maybe more reluctant to purchase a new piece of equipment that, may not be a necessary replacement for an outdated piece of equipment. And right. That's probably a risk.
We may not know about Medicaid cuts for real until mid-year because right. of the way the budget process works.
That's right.
Although it looks very much like it will be unavoidable, and the question is how much.
Right.
How much? So are healthcare systems reluctant, waiting to taking a wait and see approach in terms of their purchasing? I guess is what I'm asking.
Yeah. We haven't seen that yet, Wendy. I mean, I'm reluctant to suggest that that's the case at this point, because I think we're coming out of a earnings cycle, particularly from a lot of manufacturers that felt pretty good about the environment right now. So okay. Again, I don't want to make a prediction until we have more evidence that it's starting to come to fruition.
Right. And the other aspect is how much of, I don't know if you can answer this off the top of your head, but how much of the healthcare system, how much Medicaid exposure, how much of healthcare systems revenues come from Medicaid? Obviously that
Yeah.
varies across the board.
That's right.
Yeah.
That's a tough one. And it
Right.
varies by health system. It varies by geography, by state, and
Yeah.
you know, an inner city hospital may be much more wed to Medicaid than a hospital
Yeah.
in a suburban environment. But Medicaid will touch most health systems in some capacity.
Yeah. Well, it
And
covers
not
like
just for
Yeah.
it's a much more expansive program than I think people realize in terms of its
much
coverage.
more. I think it covers
Yeah.
about 70 million people, and including, I don't remember what the percentage is of seniors in nursing homes, et cetera.
Right.
The other thing is Medicare is off the table. I think Medicare I can't say anything is safe, but Medicare is off the table in terms of cuts. But the Affordable Care Act premium subsidies are vulnerable as well, and that will be another factor. But we probably won't know about that till the end of the year. Is that? Yeah.
Right.
So you're not built. Okay.
Yeah, I'm not certainly in DC. I'm not going to prognosticate on this, but we just have to watch it and kind of, do our channel checks around physicians and the hospital executives, as it comes through. So.
You seeing any trends in reimbursement? In reimbursement?
Sure.
Yeah.
Well, we saw a lot of activity kind of at the tail end of the Biden administration, specifically around local coverage determinations or LCDs with various MACs. We've seen some activity around things like cervical spine or total disc replacement in the cervical spine. But a lot of those programs and a lot of those policy changes took a pause at the start of the Trump administration, Trump 2.0, I should say, as the administration's changed over. So, for example, the LCDs that were going to go into effect in February got pushed to April, just so that there was kind of a grace period for some of the administration changeover. That's not uncommon to see. Now, what we're waiting on is whether the new administration, and we're still waiting for confirmation of, say, the FDA commissioner, of the CMS administrator, of head of NIH, all the sub leadership below RFK Jr. still has to be confirmed. So there is still this interim period right now where we're waiting on some of the political appointees to take over, and that may dictate changes. We don't know till they get there.
Yeah. What are some of the new LCDs that are scheduled to go into effect that you're most interested in, that you're following most closely?
Well, the biggest one, at least within our coverage universe, is actually outside of orthopedics, but it's in the wound care space. So, for example, in advanced and chronic wound care, this is the areas of diabetic foot ulcers, venous leg ulcers. We've watched this really for 10 plus years now. Medicare has tried to get their arms around what is a growing spend problem in the treatment of chronic and diabetic foot ulcers and venous leg ulcers. And the spend rates have gone from, I'll just give some perspective here, $1 billion a year to multiple billions a year. And it's because there has been such an influx of usage of high dollar products in the space. And so Medicare, for years, if you read, the old files, first there was regulation around from FDA, but Medicare was also trying to look for ways to either move to a capitated payment model, away from a fee-for-service model, and they've been reluctant to do that. Now, what we're seeing is, because of some of the abuse in the system and overutilization, they are implementing an LCD that essentially gives coverage to 18 products out of hundreds beginning April 13th. And so many of the products on the market are going to be limited, or I don't want to say kicked off, but certainly unavailable to get coverage come April 13th. Now, that's exclusive to Medicare, and it's exclusive to the physician office, so it's a fraction of a fraction of the utilization, but we expect a lot of curtailment in adoption in this area as a result of those LCDs in an effort to curb spend by Medicare. Very interesting, very dynamic, and still a lot to be seen, but we expect as a result consolidation in this market.
Okay, thanks for flagging that. But that's on hold now. That is on hold now then, pending the new administration? No.
It was delayed 2 months from February 13th, implementation on February 13th to April 13th. But we expect, as do most of the large wound care companies, that those LCDs to go into effect April 13th. They expect this to follow through.
They do. Okay. You've written recently about the new foot and ankle code. Can you talk a little bit about that? What is that, and the implications?
Yeah. So
I'm not familiar.
This has been an interesting dynamic. So we saw really significant improvements in reimbursement to select codes in the foot and ankle market, specifically for bunion surgery, from 2024 to 2025, to the tune of about 100% and 89% respectively in both the hospital outpatient department and the ASC. And so for companies that are involved in this space, think Treece Medical, think Stryker, think Paragon 28, which is now part of Zimmer Biomet.
Yes.
This is very beneficial for those providers. There's others in this space. It's not just those three. But what we've seen, and we've surveyed foot and ankle physicians in this space, is both a higher level of interest in this procedure category, and also a higher willingness to accept more product in this space. So, for example, patients who may use a piece of equipment, the manufacturers may bill that at a certain level. Well, we expect those manufacturers to have more room to sell more product because there is more reimbursement to the providers as a result of the reimbursement changes. We think that's great for manufacturers in the space. We think it's great for providers, and ultimately we think it's great for patients who will benefit from the enhanced technologies in this space.
Okay. How did that come about? What is the size of the bunion market? And what does this do? How has that new reimbursement changed your model for the market size and opportunity?
About 450,000 surgeries a year are performed in the bunion space. I think it totals about $2.3 billion annually in terms of revenue opportunity in that market. And so, that number's been fairly steady through the years, but we think with newer technologies, more patient-specific instrumentation, and there's concomitant disease in other areas of the foot, for example, when you have these bunions, we think those numbers can grow. The market's been growing as a whole in the mid-single-digit range, but we've seen really high growth from a handful.
Sales or volume? Are you talking about sales? Are you talking about growth, sales or volume? You're talking about sales or volume?
Sales, yeah, sales.
Okay, great. Ryan, I could go on for a long time. I'm going to end it at this. And thank you so much for these thoughts. I think we covered a lot of ground here, and I think you provided an enormous amount. It was great to get your expertise. You provide an enormous amount of insights.
Thank you, Wendy.
And look forward to seeing you at AAOS. Thank you so much.
You too. Thank you. Thank you.
Hey, have you heard of Market Pathways? Market Pathways provides the most in-depth analysis you'll find of the changes happening in medical device regulation and reimbursement every day. They address the complexity in regulatory affairs and beyond by helping you digest and contextualize technical topics like Medicare and MDR. Visit mystrategist.com/trial today to start your free 5-day trial to Market Pathways. Again, that's mystrategist.com/trial for 5 days of online access. We hope you enjoyed that episode. Your support is valuable and makes us better. Please remember to leave a review and rate Market Pathways on Apple Podcasts or wherever you happen to listen.